Hi and welcome to Heal My Hemorrhoids. In this video you will learn what the differences between anal fissures and hemorrhoids are, and what you need to know to cure them if you suffer from fissures or hemorrhoids. Remember to hit the like button and subscribe if you liked this video. Many people often mistake one condition for another, anal fissure versus hemorrhoids. Maybe you just noticed small symptoms that you could overlook back then. But now, it can be itching and painful to feel. Anal fissures versus hemorrhoids. Hemorrhoids are often caused by repeated pressure in the anal and rectal veins. Anal fissures are a result of trauma in the anal canal, often during bowel movements. Fissures may also be caused by inflammatory bowel disease or infection. Other factors contributing to anal fissure are constipation, straining when in the toilet, prolonged sitting, obesity, pregnancy, rectal surgery, anal intercourse, and anal infection. Looking at the differences of the anus, anal fissure versus hemorrhoid can be tricky and daunting for common folks. People are reluctant to look at the affected area because it is a sensitive matter. Keep on watching the information we share in this video to make sure you know what kind of things you are dealing with. Anal fissures, in a nutshell, are different from hemorrhoids. Generally, you will notice the signs pretty much sooner than hemorrhoids. If you have anal fissures, you will quickly know about it since it is considerably more painful than hemorrhoids. An anal fissure is the cut or tears in the area of the anus. Because it is a cut or tear, the pain is really higher than hemorrhoids pain. And it strikes you a lot because it is really painful. It is because the cut strikes your endoderm skin, which has tons of nerves that are sensitive to touch and pain. The real culprit of the anal fissures is the trauma to the anus area or anus canal. The causes are common from hard movements and large movements, to extreme scratches. Usually, the pain is not slowly graduating like hemorrhoids. Most of the patients will notice the exact start of the pain symptoms. Anal fissures are commonly fatal. When you experience this, you will likely see drops of red blood in your bathroom. But you won't need to worry since you can take care of hemorrhoid fissures with home remedies prescribed by your doctor. As the name suggests, when you suffer from an anal fissure, there are fissures in your anus. Although it can be really painful, the condition is usually short-term. And it can go away for days at max. There are several causes of anal fissure, such as passing hard stool, straining during the bowel movements, childbirth, scratching the skin, etc. While hemorrhoids are identical to swollen veins, anal fissures have small lumps around the anus. But hemorrhoids and fissures can happen. Anal fissures can happen to everyone regardless of their gender, age, and health condition. Ones who suffer from the condition can basically overcome the problem with home remedies. Clean the affected area with a plain white paper towel. Apply the ointments or cream to soothe the condition. Not to mention, changing your diet will affect you as well. Since the main culprit of anal fissures is the hard and large stool, you could manage it by changing your lifestyle. Eat more fiber and drink more water on a daily basis to make your stools softer so that you don't have to strain when the bowel moves. If the fissure is not going away anytime soon while you need to recover fast, you could consult with your doctor. Your doctor will give you a great prescription. Hemorrhoids and anal fissures. Hemorrhoids are often not a standalone condition. Many people also suffer from hemorrhoids with fissures. And the symptoms are noticeable. The sad stuff is that these two conditions can happen at the same time. There are different kinds of injuries that you can suffer from at the same time. An anal fissure is a tear in the affected area. Meanwhile, hemorrhoids are different kinds of injuries. There are two types of hemorrhoids, external hemorrhoids and internal hemorrhoids. External hemorrhoids are usually a lump or pain in the rectum. But it can also be a sign of hemorrhoid with fissure. When you suffer from external hemorrhoids, you will likely experience bleeding as well. The other type of hemorrhoids, internal hemorrhoids, have the common symptom as rectal bleeding. The blood can show up after passing your bowel. You might also see a noticeable amount of blood on the stool. In the end, the symptoms of hemorrhoid and fissures together are almost the same. When you are experiencing one of the symptoms, the safest way to make an informative decision is to consult with your doctor. The specialist will help you with the diagnosis and suggest to you the most appropriate treatments that you can take to overcome the conditions. Hemorrhoids causes and treatments. The hemorrhoids are the veins that take place in the anus area or the lower part of your rectum that become swollen. The main causes of hemorrhoids are a low-fiber diet, bad lifestyle, obesity, etc. During the bowel movements, it is possible to notice painless bleeding. There are some bumps around the affected area. Since the stools are hard and large, it can be painful when having bowel movements. Most hemorrhoid cases can be overcome with home remedies. The sitz baths are the most common ones. But you can also combine this method with over-the-counter ointment or cream topical application. Home remedies for hemorrhoids. Since the hard and large stools can make the case of your hemorrhoids more severe, you could change your diet. Drink plenty of water and increase your fiber intake on a daily basis so that the stools will be softer, and when passing, it won't make your hemorrhoids worse. Most hemorrhoids can go away in days or even faster when you are taking care of them with appropriate methods. In severe cases, you will want to call your doctor and look for the best ways to overcome the problem. The treatments can be from the prescribed medications to non-surgical options such as rubber band ligation. The surgery option will be the last harbor after every other method does not work. Although you have equipped yourself with the knowledge to handle these problems at home, these are often insufficient to take appropriate measures. If you are not sure about what you do, consider consulting with your doctor. Anal fissures may result in sharp pain when going to the bathroom, and there can be traces of blood on the toilet paper and in the toilet. If the fissure becomes chronic, a skin tag can develop in the area with the local infection. Trauma to the anal area such as vaginal delivery, anal sex, or if you have a hard stool can directly lead to anal fissures. Also, you should avoid straining when going to the bathroom. The best way to prevent anal fissure and hemorrhoids is to live a healthy life, exercise a few times a week, drink water, and eat fiber. Also, vegetables and fruits are great for preventing fissures and hemorrhoids. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. Hope the video was helpful. For more, see healmyhemorrhoids.com.